my God, is it painful? But we will cover everything, hopefully that they possibly ask it in the test. So a referral may be needed. I'm going to tell you now, most of the time a referral is needed. It kind of gets repetitive. If you are going to a military treatment facility, you don't need a referral. Blanket statement, right? If you are going to a TRICARE approved clinic outside of the military treatment facility, you need a referral. If it is an emergency, you do not need a referral. You have to notify and have it approved within 72 hours. Okay? Those are like some of the big takeaways, and I'll repeat it again in just a few minutes, but those are like the big things that you're going to see. Because it jumps back and forth with, you might need one, you might not. No, you need one. If you're not being seen at the MTF, you need one. Active duty or dependent, you need a referral.
I have a fun fact, because I didn't know this until I got here. I always thought of mental health, and I was thinking about the 8 visits per year. That doesn't actually cover exactly what you can get. You can get therapy, right? I went through here and have 62 visits covered for free, up to even more if I wanted more. So let y'all know, if you have sailors or yourselves that want to get help, it's not just 8 visits. You can do the referral that she's talking about, and I believe I know I went to Sewell's Point. There's like a program, health admin person there that can write you a referral out in town to get seen. And mine's all virtual. So just a nugget for y'all. If you knew they were limited, you guys can all get therapy if you wanted it for free.
So it says most situations, prior authorizations are not required for any outpatient mental health or SUD visit. Everybody knows that SUD is a substance use disorder, right? Okay. So prior authorizations and referrals are 2 different things. Okay. So you don't always need a prior authorization, but you need a referral. Or vice versa. It depends on which one. If you end up an inpatient, then you get your prior authorization if you're admitted within 72 hours. Active duty service members, if you seek non-emergent mental health treatment at a military hospital or clinic, it's completely free and you don't need a referral. If it's not available, because our access to care sucks, a referral or prior authorization from your PCM before receiving civilian care is a must. If you do not have a referral or prior authorization, TRICARE can charge you. And they will charge you. You'll pay like a copay kind of thing. TRICARE will pay for it, but not all the way. So certain mental health and SUD services may not be available overseas. It says that in this pamphlet 40 times. Just know, if you're overseas, things are different. Psychotherapy. So this is for adults or children for emotional issues that impact their ability to function, to reverse or change troubling behavior, and to help with coping in times of personal crisis. The appointment can last anywhere from 60 to 120 minutes. For family or conjoint counseling, it's 90 to 180 minutes. The 180 minutes is for crisis counseling. 90 minutes is your traditional time frame for family or group counseling, or family or partner counseling. TRICARE does not pay for marriage counseling. That's not in the slideshow. It is in the pamphlet. I can see that being a test question. Does TRICARE pay for marriage counseling?
No.
It does not. However, Fleet Family, that's covered. Group.
So does chaplains with your marriage credo retreats.
Exactly. Yeah, the credo retreats are really cool. So group therapy, that's multiple patients, you're not related to them. They usually last 90 minutes. Collateral visits, not a therapy session. That's used to gather information, implement treatment goals, things like that. Those are 60-minute appointments. And they can be combined with an actual mental health visit. Psychoanalysis is the
I'm sorry, I'm trying to write this down really quickly.
You're fine. I would know individual therapy, 60 to 120 minutes. Family or conjoint therapy, 90 minutes, typically 180 for crisis. In the pamphlet it says crisis is mostly. Are we good to go?
Yes.
Psychoanalysis is your long-term therapy. It explores unconscious thoughts to gain insight into behaviors and symptoms. And it can only be done by approved providers with and have prior authorization. Psychological testing and assessments are covered. And I don't like the way this is worded because it says it differently than it says it in here. So it is covered testing and assessments when medically or psychologically necessary and provided together with otherwise covered psychotherapy. TRICARE also covers psychological testing and assessments when it's a required part of the assessment and reassessment process for applied behavior analysis under the autism care demonstration. So it's not just for autism. Like this kind of makes it look like it's just under the autism care demonstration, and it's not. It can be part of that though. There are some exclusions. You cannot use psychological testing or assessments for academic or job placement, child custody disputes, teacher or parental referrals, general screening in the absence of specific symptoms, testing for learning disabilities or disorders, so like IEPs. This is not, TRICARE doesn't cover IEP appointments, and testing related to learning disabilities or disorders. So if you think your child is dyslexic or has some other type of learning disorder, TRICARE does not cover those appointments. Medication-assisted treatments, also called MAT. It's a combination of drug and mental health therapies to treat SUD. So obviously the providers have to be credentialed, only available in the US and US territories, or generally available in all US and US territories. Obviously that's going to be different overseas depending on where you are. Opioid treatment programs. The providers determine if it's necessary or not, right? So office-based SUD treatment can be done with TRICARE providers acting within their scope to prescribe medication. An organized intensive outpatient program. So the IOP I would know about, it's an organized day or evening program that includes assessment, treatment, case management, and rehabilitation. It requires 2 hours a day. It can be literally any time of day. They can be in a day session if they work all day and they need an evening or a night session, they can do those too. It must be 2 hours a day up to 6 hours a week, or at least 6 hours a week. And this is only for patients that don't obviously require 24-hour monitoring. Partial hospitalization program, it's used to stabilize a critical mental health disorder that does not require 24-hour care in an inpatient psychiatric setting. This is typically like if you have a child and they're going home with parents at night and they're staying in the hospital during the day and then they go home with parents, or somebody that has a spouse and they're going home with somebody, they have a care plan at home. It's usually only available in the US and US territories. Medication management, obviously managed under the provider who is authorized to prescribe mental health medication, and they will manage dosage and duration. So you can't go see a mental health provider, they give you your medication, and then you go back to see your PCM, and your PCM refill that medication from your mental health provider. It has to be the mental health provider. Inpatient services, referral and prior authorization is required for non-emergency inpatient mental health care services. So if it's inpatient, you must have prior authorization if it's non-emergent. Emergencies do not require prior authorization, but extended stays do. So if you are admitted, so you go in for the emergency, they admit you, you have to report to the regional contractor within 24 hours or the following business day. and you have to have your authorization within 72 hours. Acute inpatient psychiatric care. So mental health disorder that threatens the patient's physical well-being or the well-being of others, so suicidal or homicidal, to the extent that medical and psychiatric care is needed for a 24-hour basis for safety and stabilization. Emergency care needs to prior authorization only for extended stays, right? So emergency care, you don't need a prior authorization, they admit, so it's just saying the same thing the last slide just said. Psychiatric residential treatment care, this is typically like your rehab centers, provides extended care for children and adolescents who have mental health disorders that require treatment in a therapeutic environment 24/7, so that's inpatient psychiatric ward. For children, SUD cannot be the primary diagnosis for inpatient psychiatric treatment. So if they have a substance use disorder, they cannot go to an inpatient psychiatric ward just on the SUD diagnosis. The primary diagnosis has to be schizophrenia or whatever. Sometimes occurs as a step-down level of care, like if they were emergency inpatient and then they put them over to the residential treatment center. Okay, so somebody that's trying to commit suicide, right? They go to the emergency room, they go to like the 5th floor at the hospital, and then they come off of the 5th floor and then they go to residential care. And this is more of like a home living environment, they go to school, things like that. And it can be used as a step-up level of care. So if your child is starting to show signs of wanting to harm themselves or attempting to harm themselves or something like that, no longer safe in their home environment, you can ask for residential care for them. So rules for residential care, facilities must be TRICARE authorized. Unless therapeutically contraindicated, the family or guardian should actively participate in family therapy with the child. Prior authorization by regional contractor is required before the child goes to residential care. Psychiatric residential care is not considered an emergency, so you have to have the prior authorization. In an emergency, inpatient hospital is to be sought out first, so of course you're going to go to the ER admission to 5th floor if it's an emergency. Again, SUD is not authorized for RTC care and only for beneficiaries under the age of 21. That's the biggest takeaway I would say is there. One, you need prior authorization for residential care, because that sounds like a test question. And the other test question would be only for patients under the age of 21. You cannot get residential care for your child that is 23 years old. You have to be under the age of 21. Or 21. 21 and younger. Inpatient and residential substance use disorder rehabilitation facility care. TRICARE only reimburses the cost of care if visited at a TRICARE authorized facility. So if you are like, well, I don't like that one, I want them to go to this one, like the private school that you want your kid to go to, you have to pay that out of pocket. TRICARE won't cover it. Detox. Emergency and inpatient hospital services for the treatment of the acute phase of substance abuse withdrawal with the patient's disorder requires the personnel and facilities of a hospital. So that is if you have somebody in your family who is detoxing and they are having convulsions, they are to the point of dehydration that you're concerned of, like, heart attack and death, stuff like that. That is when emergency care is authorized. If they are detoxing and they're just sick, emergency care is not authorized. Residential substance use disorder rehab, pre-authorization is required. Regional contracts may have additional requirements depending on what region you're in. Typically, you need a referral for it, and it can come from an ER visit, referral, whatever. Services not covered by TRICARE. There is a gigantic list, but some things like aversion therapy, biofeedback for psychosomatic conditions, custodial care, educational programs, experimental procedures, marathon therapy, megavitamin or orthomolecular therapy. Does everybody know what aversion therapy is? It's shock treatments.
That's usually the question they put on the test. The one that's not available, and it's usually aversion therapy.
Yep, aversion therapy. That's where you do the behavior that you're not supposed to do, and they cause pain or discomfort to you every time you do it. So it teaches your body to stop doing the thing that you've been doing.
It's pretty fucked up.
Shock therapy. Again, there's a lot more listed in the pamphlet. Emergency versus non-emergency. Emergency is a serious medical condition that the average person would consider to be a threat to life, limb, sight, or safety. Active duty service members need a continued stay authorization form from military hospital or PCM within 24 to 72 hours. So again, if you're going to be admitted, you have to have that pre-authorization form within 72 hours. You have to notify within 24, notify the region contractor within 24 hours or the next business day, but you must have the authorization within 72 hours of admittance. Non-emergency, PCM can provide initial assessment and possibly treat. PCM can order a referral, and the active duty service member must get authorization to see civilian providers. You cannot just, like we've been talking about, you can get it anytime, anywhere, blah, blah, blah. You can, but you better get the authorization within 24 hours, or you're paying for it out of pocket. Don't just walk into some psychologist's office and be like, can you see me? I want to cry. And think TRICARE is going to pay for it. They won't unless you tell them within 24 hours. Active duty service members, no cost when care is received from authorized.
We just have to create codes.
By the military health system. Again, authorization. Non-active service members, minimum cost.
For those.
Minimize cost by using TRICARE network providers. You may still have a copay. Are there any questions on this? It is a super fun read. I highly suggest you read it. I think we covered anything that might be on the test.
They're trained in their separation date? The transfer date?